Hi everyone, welcome to my channel. In this video, I'll be saying about the clinical of the brachial plexus. If you have not checked the video of the brachial plexus, then do check it out. So first we have the Erb's paralysis. In Erb's paralysis, the site of injury is in the region of the upper trunk of the brachial plexus. Okay, and here there is an Erb's point. So if this is a brachial plexus, I have already drawn this one in my previous video. Check it out. So see, this is the upper trunk. I have said you that C5 root and C6 root joins and forms the upper root. So what is the Erb's point? Erb's point is that where the 6 nerves comes and meet. That means C5, C6 comes and here and meet here, and from here the trunks are formed. Upper trunk is formed. Okay. This upper trunk now before giving divisions gives two more branches, that is a suprascapular nerve and one more is nerve to subclavius. Okay, and this anterior and the posterior division. So 1, 2, 3, 4 and 5, 6. So this point is called as the Erb's point. See, I am showing you the zooming of the upper trunk only. So if this is the two nerve roots C5 and the C6, okay, then these two joints and forms the upper trunk. So this is the upper trunk, okay, and this upper trunk further gives divisions. So anterior division, and this side is the posterior division. This is the posterior and this is the anterior division. Okay, and now more two nerve arises before giving to the divisions. What are they? They are the, see, there is the nerve to subclavius one and one is suprascapular nerve. Okay, so this point of meeting of the 6th nerve is called as the Erb's point. I hope it's clear to you. Okay, so this is the upper trunk is the site of injury of the in the Erb's paralysis. Okay, so causes of injury is that undue separation of the head from the shoulder, which is commonly encountered in the number 1 childbirth, okay, or difficulty in the childbirth. Number 2, fall on the shoulder. Number 3, during the anesthesia. Okay, the nerve roots which is involved, as you can clearly see, C5 and the C6 nerve root. Okay, so muscle paralyzed are mainly the biceps brachii, deltoid, brachialis, brachioradialis, and partly the supraspinatus infraspinatus muscle. So the deformity in the position of the limb is the arm will be hanged by side. It is the adductor and the medially rotated, and forearm is extended and pronated. The deformity is also known as the policeman tip hand or the waiter's tip hand or a porter's tip hand. Means that position a waiter takes a tip. Okay, that is a special posture how he takes the tip. So Erb's point is the important short note which can come in the theory paper. Okay, so what are the disabilities? He loses the abduction and the lateral rotation of the arm at the shoulder joint, flexion and the supination of the forearm, biceps and the supinator arc are lost, and the sensation are lost over a small area over the lower part of the deltoid. Okay, so these are the things he is not capable of doing. Now next, which we have the clinical, is the Klumpke's paralysis, which is again an important short note. Klumpke's paralysis site of injury is the lower trunk of the brachial plexus. So this is the lower trunk of the brachial plexus. You know, it is formed by the C8 and the T1 nerve root. So this is the most common site of injury. Causes of injury is undue abduction of the arm, as in the clutching something with the hand after a fall from a height, or sometimes in the birth injury. The nerve roots which are involved is C8 mainly and mainly the T1 nerve and partially the C8 nerve root, and the muscle paralyzed is the intrinsic muscles of the hand and the ulnar flexures of the wrist and the fingers. Deformity in the position of the hand, that is claw hand, due to the unopposed action of the long flexion and the extension of the fingers. In a claw hand, there is a hyperextension at the metacarpophalangeal joint. Okay, there is a hyperextension of the metacarpophalangeal joint. Means this is the metacarpal and the phalangeal joint. So in this joint there will be extension. Okay, now next we have and the flexion at the interphalangeal joint. And again you will find the hyperextension of the metacarpophalangeal joint and hyperflexion in the interphalangeal joint. So these both are the interphalangeal joint between the phalanges of the joint. So like this it will be the position will be like this. This is called as the claw hand. Okay. Now next, the disabilities. Disabilities are complete claw hand, cutaneous anesthesia and analgesia is in a narrow zone along the ulnar border of the forearm and hand. Okay. So next, the clinical I will be talking about is the injury to the nerve to serratus anterior or the nerve to bell. I have said you the long thoracic nerve is the nerve to serratus anterior muscle. So if this nerve is injured, what will happen? Cause is sudden pressure on the shoulder from above, and number 2 is carrying a heavy load on the shoulder. Okay, so deformity is winging of the scapula. If you don't know what is winging of the scapula, then do check the scapula video. I have already given it there. Okay, and that is excessive prominence of the medial border. So in the winging of the scapula, you can see the prominence of the medial border of the scapula. Normally, the pull of the muscles keeps the medial border against the thoracic wall. What are the disabilities? Loss of the pushing and the punching action. You cannot do the pushing and the punching action. Okay, and during the attempts at pushing, there occurs a scapular winging of the scapula. So if you try pushing or punching, so it will occur as a winging of scapula. Overhead abduction you cannot do of the shoulder girdle is partly affected due to the intact trapezius muscles. Okay, so these are the clinical, and there are more important ups and the Klumpke's paralysis and injury to the serratus anterior. It is called as also the nerve of Bell. Okay, these all are the important short note questions which may come in your theory paper. And brachial plexus is a long question. It may also come in the theory paper, and where you have to write the clinicals. So that's all. Thank you. Do share, subscribe and like the video.